what that paper really discussed was actually using psilocybin for chronic pain. That they look at more like spinal cord injury, phantom limb pain, and phantom limb is actually a great example of how someone no longer has a limb, yet they sense pain. So how is that possible? You don't even have that physical body part. So the brain obviously constructs the pain into your consciousness with contributions from your body, but your body doesn't even have that limb anymore. So the paper was really discussing psilocybin for this type of pain, which is called nociplastic pain. So it's not an acute trauma that heals on its own, that's what we call nociceptive pain, and it's not exactly neuropathic, like if you had diabetic peripheral neuropathy or sciatica. This is nociplastic pain where it's living in the central nervous system. And they talk about functional connectivity, so basically different parts of the brain that are currently being reinforced by that glutamate ingraining that signal. Over time, what needs to happen is that needs to be quiet, and we need to start to work on other brain regions communicating. And so, like the classic psilocybin picture that we all see about the placebo versus giving the brain psilocybin, you see an increase in functional connectivity, an increase in communication, and that doesn't just stop pain, but it actually helps someone learn new things and realize they can change their behavior, they can change their relationship to pain. And I look at the brain like a danger detector. Okay, we all basically have this prediction model of what is going to cause us pain based on our previous experiences, based on our relationships in the past, based on how secure we feel within ourselves. So the brain is really there to protect us, and when someone's in chronic pain, they're not able to really tap into something if it's going to be painful or not, because it's like a fire alarm that's going off in a faulty way. So what a lot of these psychedelics do is allows you to take a step away from your pain and really understand that that's not your identity. You don't have to be defined by the pain, but it doesn't happen unless you give someone a way to connect with themselves, to understand that they want more to life. And a lot of people are just in this rut where they're not really able to get up and start exercising and eat healthy and start to socially be involved with other activities. So they need this catalyst to really wake them up and connect to themselves, because they lost who they are. And it's really a nice time, because what we've seen is that our current treatments for chronic pain are not working. So clearly we need to think outside the box or start to investigate other options. But I mean, we have so much anecdotal evidence of using psychedelics. It's a difficult time because they're Schedule I drugs, and that's why obviously we're using ketamine for so many things off-label. But I do believe that ketamine actually has a great place for nociplastic pain. I just think it, again, starts with education from medical school, and also validation to patients that, yes, we do know you're in pain, we do understand that you're in pain, whether it's emotional or physical, but there has to be a safe container and this therapeutic alliance to help them move forward.
Thank you.